This is an overview of autism spectrum disorder. Autism spectrum disorder, which we will refer to throughout this presentation as ASD, is a neurological disorder which affects the way the brain develops and processes information. So let's review some of the things we know. The CDC has been tracking the prevalence of ASD through a multi-state network of centers. In the last release of the data in 2016, the CDC estimates that 1 in 68 children are diagnosed with ASD. This number has continued to rise over the years and will likely change again. ASD is more likely to occur almost 5 times more often in boys than in girls. Research is occurring internationally in many areas, from genetics to treatment, with hopes of determining a cause for effective intervention. ASD is found across all ethnic and racial groups around the world, although we do see a disparity in minority groups in receiving early diagnosis. Having healthy brain connectivity makes the things people do and say very fluid and easily completed. ASD impacts these important connections from one part of the brain to another. Research tells us that these connections are not fully developed in people with ASD and limit them in areas such as social communication and restricted and repetitive interests or behaviors. Some people with ASD may develop seizures. Usually they occur with the onset of puberty. Doctors may recommend medications to help reduce seizure activity. ASD may occur with other genetic or mental health conditions. We sometimes see issues such as attention deficit hyperactivity disorder, or ADHD, learning disabilities, anxiety, or other mental health issues, and thus it is important to work with a professional well-versed in understanding the various aspects of ASD and coexisting conditions. There are verbal and nonverbal IQ tests that measure a person's cognitive abilities. Oftentimes, people with ASD have difficulty in new situations and with new people, so we must be cautious about how we interpret tests given in these types of settings. The results of these tests can be an inaccurate reflection of abilities and intelligence. Language and communication difficulties, as well as the potential difficulty of demonstrating skills in stressful or unfamiliar testing situations, may affect the results of the test. Research has demonstrated a high rate of uneven cognitive development in children with ASD. Although a person on the autism spectrum may demonstrate great strengths in one area, they may also be severely lacking in another area. As providers, we should not make assumptions based solely on IQ or a person's ability in just one specific area. We have to look at the entire picture and not just the parts. Characteristics of ASD can range from mild to severe. One person may be employed and live life on his own, while another may need assistance with simple activities of daily life or holding a conversation. There is a wide range of abilities, and the manner in which people with ASD progress over time is an individual process. It is a misconception that people with ASD always want to stay in their own world. People with ASD want to make friends just like everyone else does. Communication abilities in individuals with autism are often delayed, and approximately 50% of individuals may never progress to spoken language. When an individual does develop spoken language, they may be unable to sustain a conversation unless it involves something of personal interest to them. Nonverbal abilities and social skills are also impacted by autism. Reading social cues from others and defining appropriate personal space can be particularly difficult for these individuals. These deficits in social communication can negatively impact the ability to successfully navigate a social world of friendship, school, and work. There is no medical test for ASD. The best way to determine if someone has ASD is through observation by a trained diagnostician or medical professional, and by collecting information on their social history. There is a manual we will talk about in the next few slides that shows the exact criteria for determining diagnosis. While there is no known cure for autism, there are therapies and education approaches that can address some of the challenges associated with the condition. Intervention can help to lessen disruptive behaviors, and education can help teach some self-help skills for greater independence. This information was taken from the Diagnostic and Statistical Manual, 5th edition, of Mental Health Disorders. It provides the criteria of the area of social communication, one of the 2 major deficit areas for people diagnosed with ASD. We are looking to see the concerns listed in all 3 areas. Remember, these issues represent a level of severity that limits the ability of a person to be successful in relationships, school, or employment. They do not refer to people who might be less social, shy, or awkward. There are qualitative differences in the way people interact and communicate that set them apart from their typical aged peers. People with ASD will say that sometimes they feel they do not fit in, and they do not understand the way others act or things that they say and the intentions of others. They cannot read the environmental or social cues that guide our behavior. The domain of restricted and repetitive behaviors requires a person to meet at least 2 of the 4 deficit areas. People with autism spectrum disorder oftentimes have motor movements that they indicate that they cannot always control. An individual with ASD might engage in hand flapping, rocking, or toe walking. In terms of routines, although many of us function within routines during the day, we can also be flexible if our schedule changes or if something gets canceled. However, people with ASD can be rule-bound, and these changes can cause great distress, and we might see some resulting behavior issues. People with ASD have a very strong areas of interest and will focus their time and attention on one until they acquire a high level of expertise. This can be a great asset for employer purposes if the employer is seeking that sort of gift in someone. On the other hand, it can also interfere with relationships between people if the person with ASD only wants to talk about their interest area to the exclusion of the peer's topic of interest. The DSM-5 has included additional criteria. We expect to see signs and symptoms appear in early childhood, but for some, we may see a child who develops adequate skills in the social communication area through interventions, but as they get older, the development of age-appropriate skills may begin to lag behind. Occasionally, individuals with autism spectrum disorder also demonstrate other behavioral patterns or characteristics. One of these patterns is unusual mood or affect. This means that the facial expressions, body language, and tone of voice of the individual may not match or seem appropriate to the circumstances or the environment. This might be expressed as a noticeable lack of emotional reaction at occasions in which most people would typically express their feelings through smiles, laughter, or crying. On other occasions, people with ASD may laugh or seem extremely agitated when nothing seems to be particularly funny or exciting for other people. Another possible characteristic is eating or sleeping difficulties. Individuals with ASD may only want to eat certain types of food or may have a reluctance to eat food with particular textures, flavors, or odors. Others may have irregular sleep patterns. You may also see challenging behaviors. Challenging behaviors are particularly an issue for individuals with significant expressive and receptive language abilities. Lastly, hyperlexia, or advanced word decoding skills, will occasionally be apparent in young children with ASD. These children may demonstrate an extreme interest in letters and word spelling, but often don't demonstrate word comprehension abilities at a similar level. In summary, it is important to remember that children with autism are children first. So set high expectations, teach rules, and set up the situation for success, just as you would for all children. The best teaching occurs through positive relationships, so learn to engage the child with autism in ways that work best for him or her. Understand how to use reinforcement to build momentum and new skills. Having a functional communication system will increase social skills development, as well as reducing problem behavior. Many skills need to be taught through direct instruction in the setting in which those skills will be used. CARD USF is here to assist you in learning those tools and strategies that will create successful experiences.